We all have heard about the disease which are concerning, but very few know about thalassemia. It is one of the alarming disease which was found and described in 1925 by a physician who studied Italian children with severe anemia, poor growth, huge abdominal organs, and early childhood death. In 1946, the cause of thalassemia was found to be an abnormal hemoglobin structure. It is an inherited blood disorder characterized by less hemoglobin and fewer red blood cells in body than normal. This blood disease is inherited by children from their parents. Due to this disease, there is disturbance in hemoglobin production process of the body, due to which the symptoms of anemia appear. It is also recognized only after the age of 3 months. The symptoms of this blood disease are abdominal swelling, fatigue, shortness of breath, dark urine, weakness, headache, and there are rare cases where babies show symptoms immediately at birth and some show signs of thalassemia during the first 2 years of life. There are two types of this disease, that is alpha and beta. Alpha is when genes related to the alpha globin proteins are missing, whereas beta is when similar gene defects affect production of beta globin protein. These types have two major parts further, that is thalassemia major and thalassemia minor. A child can only be born with thalassemia if they inherit these faulty genes from parents. For example, if both parents have the faulty gene that cause beta thalassemia major, there is 1 in 4 chance of each child they are being born with this condition. The parents of child with thalassemia are usually the carriers. This means they only have one of the faulty genes. Thalassemia is often detected during pregnancy or soon after the birth. Screening for this disease in pregnancy is offered to all pregnant women in England to check if there is risk of child being born with this condition, and some types may be picked up during the newborn blood spot test. Also, doctors in India too suggest to go through this test so to prevent another case of thalassemia. Since thalassemia patients need regular blood transfusion every fortnight, they need to be issued the safest possible blood. Repeat voluntary blood donors are the best donors for thalassemia patients, as their blood is regularly tested in blood banks for transfusion. Transmitted infections like HIV, HBC, HCV, and malaria. Some reputed and big blood banks maintain a donor registry for such patients where 5 to 6 donors are reserved for one particular patient. Their phenotyping is matched and they donate blood regularly for that particular patient so that he or she does not develop any antibodies against the donor's blood. Also, there are times when there is deficiency of same blood required for patients. So, for A positive, doctors use AB positive or O positive as it is universal donor blood group. Much of Indian population resides in villages or is below poverty line and uneducated. So such health facilities for them are out of reach. Either they do not approach healthcare facility or are reluctant to such treatment because diagnosis and management facilities are available only at district level and in larger cities. But in Ludhiana, to help these unprivileged kids suffering from thalassemia disease, an NGO called Zindagi Life Foundation came up with an initiative to help people by bearing the expenses of medicine, treatments, and providing blood by holding camps every fortnight. With this, the World Health Organization Action Framework to advance the universal access to safe, effective, and quality assured blood products by 2023 aims to provide a strategic direction to global efforts to address present barriers to the and availability of blood products. Access to safe, effective, and quality assured blood products can only be achieved through effective collaboration among World Health Organization, its member states, and other relevant organizations for preventing the future of thalassemia patients globally. People with thalassemia major and other serious types will need specialist care throughout their lives. The main treatments are blood transfusions, skeleton therapy, and the only possible cure for thalassemia is stem cell or bone marrow transplant.